We are live on Facebook. Hello, Patchwork world and family. I'm Alex. I'm here, and today I have our special therapist, Miss Jennifer, and we're going to get to know her today. How are you doing?
I'm doing well. I'm doing well. Thank you for having me.
Yeah, staying cool in these really hot days here.
Yes. I was at Panera and I was just feeling bad for some of the people that I could tell were outdoor workers. And I was going back to my air conditioned house. It's like, oh, stay cool. So I feel bad for the people that lost. That's happened before where our power's gone out and it's really hot out. So
did you guys lose power where you're at?
We didn't yesterday, but we have before. But other people I saw in the news are without power today because of the storm.
Oh, geez. I'm working at a school today, and there's no air conditioning in this school. And so I was like, I'm gonna wear clothes that are thin, and I'm gonna be prepared to be uncomfortable all day.
Yes. Well, you're ready for the school avoidance and school refusal topics. So that's why you're in the setting, you're in the mode.
I manifested it. I'm ready. It was part of my plan that I didn't even know was part of my plan. Yeah, I'm in a school and I'm ready to talk about school refusal. And but first, I want to get to know you and introduce you a little bit for the people that haven't met you before, because you are new to Patchwork, kind of still.
Yes, I am. And so I'm Jennifer DeBosschere, and there's another Jennifer, and we both started around the same time. So that's why we use our last names here. But I started in the summer and be here today. Previously, I've done work as a social worker in a correctional center, in a community center, in an elderly placement, and then in a high school in the south suburbs for a couple decades. And I retired, and I still wanted to work as a therapist, so that landed me here, and I'm very happy to be here at Patchwork.
And we're happy that you're here. We're excited to have you as part of that team. Is there a bit of a delay? I'm sorry.
Yes, I just glitched, so I don't know.
Oh, I don't know. Well, we'll keep moving, pushing forward here. I don't know if it's mine or what. So let's talk about school. Let's get into it.
And I wanted to talk today about school refusal and school avoidance. And I'm going to be really general. I'm going to talk about the populations of kids from kindergarten moving on up to 12th grade. And this is a phenomenon, and I'm going to explain what it is, but it occurred before the pandemic. But after the pandemic, it just got much worse, I think.
Oops, I think we have lost Miss Jennifer. Let's see if we can get her back.
Okay, sorry.
That's okay. We lost you there.
Okay, I'm sorry. If anything, I have my phone. So again, some kids we found during the pandemic did not like being at home and would rather be in school. Some kids they were able to do better. Some of those perfectionists, they were able to do better when they were home. So they didn't want to come back to school. So we just saw the numbers of school refusers and school avoiders increase after the pandemic. So this is what schools are grappling with now. And a lot of schools are doing a lot of different things to capture this population. And if you look at why it's
we've lost her again. She must be having a bad internet connection, and I'm so excited to hear this topic. Here she comes.
Okay, so I'm just going to stop when I see that happening. I'm sorry about that. So we have the law that tells us that kids in Illinois, kids from the age of 6 to 17 have to be in an educational setting. I'm going to get to homeschooling. They have to be in some kind of education placement. And if you think of why, you could think of the, what's the value of going to school? We have kids going to school because for the most part, we want them to learn. We want them to learn material, different subjects, become proficient, whether it's math, English, geography. We want them to learn skills like how to share.
Oh, we've got to love technology. Yes, we want our kids to learn how to share and be excited about school.
Yeah. And then up to high school, when some theories say they're learning, teenagers are learning who they really are, their identity formation. So their social skills, emotional skills, physical skills, and obviously them to be productive members of society when they leave the building. So we want them to do well, to eventually graduate with diplomas, and again, to be a productive part of society and go from there. So that's why school is important. With school attendance, the way I see it is there's a continuum, and I don't know what kind of student you are, Alex. I'm going to call myself out. We have those kids that, and I was not one of them, that K through 12 or, all throughout K through 8. Again, I wasn't one of those. So that's at this end, or kids that rarely miss school because they either like school or they know school is important, or for whatever reason, they have great attendance from preschool on up. Then you go a little bit more this way. And I probably was in the middle where, orthodontist appointments, you don't feel well. I will say I worked at a local McDonald's when I was in high school. Can you hear me okay?
I keep losing you. I don't know how good the internet connection is where you're sitting, but yeah, it
Okay.
keeps breaking up.
Well, just tell me if I should go to my phone, if that's better.
You could try. I don't. Oh, I guess she's going to her phone. Good. We're gonna hear about her experience at McDonald's, and I don't know if she's gonna call me out on what type of high school student I was, but
I'm sorry, what'd you say?
I said I don't know if you're while we were waiting if I was gonna have to get called out on what type of high school student I was.
Well, I will tell on myself. So I started working.
Oh, oh my
School,
goodness.
and I was a good student up to then. So when I would have to close, I would tell my mom the next morning, can I just miss school? And okay, I'm going to log out of this.
Go ahead. We'll switch over to your phone. That's fine. That's good. I can hear you.
Okay. So I started missing maybe once a week for a little bit when I knew I was, had to close the night before and then I would miss. Well, what ended up happening is because I did want to go to college and I wanted to get good grades, I was staying after to make up quizzes and I was always playing catch up, and that was harder. So after maybe missing 3 or 4 times, I was mature enough to be able to say, I just going to school. It's just easier just to go to school and be a little tired and not have to stay after and make up. So I won't ask about what students, but so that's the bulk of the middle. We just miss here and there, but we're able to do okay. At the very far end of the spectrum are students that end up becoming either school refusers or school avoiders. So what is that? Um, that's just as they say. As the name says, they are refusing to go to school. Um, they may say, I'm not going to school tomorrow. Usually it starts out when they're, especially if they're younger, it starts out with something vague, like a somatic complaint, like maybe a stomach ache or a headache, toothache, and they feel fine Sunday night, and Monday they're like, God, I just don't feel well. And if this keeps going on as a parent or guardian, you think, okay, is this anxiety? Is there something going on with school? Or is it physical? Is there a physical reason? So if this starts coming up and you see a pattern, what I would suggest is have it looked at. Like, so check it out with a physician and see if there's any basis for that, because there may be. If you go to the doctor and the doctor clears him or her, then it's more than likely anxiety. And there's really some core reasons why a student would not want to go to school. The first one is again physical. The second one is maybe something's going on at school. So if they're the student that always went to school, never gave you a problem, and then all of a sudden didn't want to go after something happened, and maybe you saw a lot of things going on with social media, and maybe, and again, I'm just giving different examples. Maybe a student becoming a little bit more sad and a little bit more quiet. Well, what makes you think there might not be a bullying issue? A bullying issue, or maybe something's happening with a breakup. So somebody's trying to avoid school because they're trying to avoid that situation. So that happens every once in a while. And for that, I would first of all, try to take your child for a drive to talk about it. It always seems better to sometimes take, especially when they're in high school, take them out for a ride in the car, because you have their attention a little bit easier. But talk to them if you're not getting
Captive audience.
What? Yes.
Captive. Yeah.
Exactly. So if you're having trouble getting anything, or even if you hear what's going on and it is that kind of situation that I described, and even if your child says, please don't call the school, I don't want anybody getting told on, I don't want anybody calling down, they'll call me, a tattletale, a narc, or whatever. I would still encourage you to call the school, because again, your value is having your child in school, and you want the problem stopped. So feel free to reach out to whatever in the school that might be the pertinent person. In the high school, it might be the dean or the guidance counselor or the social worker. In a middle school or grade school, it might be the principal, and have a comfortable conversation with them. You could be honest and say, listen, Lucy, I'm making up that name. Lucy told me not to call you. She's so afraid of getting termed that she gave someone else's name. But school administration are really good with not, with kind of white lies sometimes, where they can address without giving that student's name or without saying how they found out information. And so that might take that kind of call, and then a plan could go from there. So I can give you hundreds of examples in my school history as a school social worker where that worked. Another reason is just because kids have learned they can do things at home that are more fun. So gaming, maybe someone has a gaming addiction, maybe they're big with social media. So that's another reason. And I say this in a non-judgmental way, because here at Patchwork and with most therapists, we're not talking to people because we want to judge them. But for different reasons, some parents might have more of a laid back, easygoing kind of, I want to be best friends with my child relationship, and it might be hard for them to say no. So in those cases, the student says, I don't want to go to school. And the parent's like, all right, let's go shopping. So that might lead to some problems.
Yeah, that sounds way more fun. I'd rather go shopping than go to school. Yeah.
Oh, for sure. Or be on social media all day, Yeah. So, but again, what's the value? How are they going to, pass their classes, learn all those skills we talked about, and eventually graduate? So you have to look at what the value is. Now, before I forget, in Illinois, there was a law passed in 2022 where Illinois kids do get 5 mental health days per year. So if those days are needed for mental health reasons, that's why they are there. So a parent would call in just like they're calling in sick. So feel free to use those days. But again, I'm talking about when things are more excess, more on the school avoider, school refusal type. The last core reason why kids don't want to go to school has to do with anxiety. So whether it's social anxiety, they're worried about who to sit with at lunch, who to play with at recess. Um, Maybe they're overwhelmed with classes. Maybe they're worried they're going to throw up or their anxiety is going to act out in class. So that's primarily what we see. And parents are pretty upfront about it, where like, I just don't know what to do. My Susie won't go to school because they're so anxious. So I'm just going to keep them home.
Or it can
Now,
become a fight or a struggle that that the parents get exhausted with.
well, thank you for that segue. So that's pretty much the
Oops.
they might still be attending. Now, they might go in tardy a lot. They might want to be in the nurse's office. They might want to be with a social worker, guidance counselor, principal. But they're starting to feel like school is a struggle, but they're not adamantly avoiding everything. But they're starting to give you a problem. So if you find, for example, that you're dealing with things more often, if the resistance is getting higher, if their anxiety and level of distress is growing, and if it causes more of an issue at home, like where a parent has to go to work and pick up a little brother or drop off a little brother at the bus stop, um, then if things keep increasing in that area and the student is still saying they're not going to school, then we're looking, it could turn into a school avoidance problem, where they're everything to do with school. Sometimes kids will do the work at home, but often they just stop doing the work too, which causes another problem where they're getting behind in assignments. So they feel overwhelmed because they don't even know how to catch up. So does that make sense so far?
Yeah, it
Okay.
very much so does.
So I'll talk a little bit about anxiety, what anxiety is, clinical anxiety.
Right.
So there might be some racing thoughts, there might be catastrophic thinking, which you could think of a snowball going down a hill, or I use my oh my gosh statements. So if you have that student that's afraid of, I'm just going to make up an example, afraid of fainting in class, and they get um, I feel a little faint, but I'm not going. I'm gonna let the teacher know I'm not doing well, so the teacher can look over at me once in a while to see I'm okay. The person with anxiety probably won't say anything to anybody and will be thinking, oh my God, what if I faint? Oh my God, what if I faint right here? What if I faint when I'm walking in? What if everybody has their phone on and they catch me and they start filming me? And then what if I fall on my face and I look ridiculous? So you know what I'm saying? It's called catastrophic thinking, where in each example, and this could happen in seconds, and in each second, the scenario gets worse. On top of that, cognitive thinking, they might get more than likely physical symptoms where their breathing starts getting affected, and maybe their face turns red, or maybe they feel like they are going to faint or throw up. Or so then when your body's acting like that, it's even harder to manage the anxiety. So you have an anxiety attack, panic attack, and again, that's on a small basis. But if that keeps happening, and nothing is really done, and if that student then says, I can't be in school, I need to be at home because it's safer there and I won't have to deal with school, and the parent or a guardian isn't sure how to handle it and lets them stay home all the time, well, then that just kind of reinforces that home is going to be okay. And they'll say, I just want to be homeschooled now because I don't want to have to deal with anxiety. And anxiety is tough. And kids that have it and people that have it don't want to have it. It's not a fun thing. It's not something to ask for. And it's very hard to explain it to someone that doesn't have it. Um, and again, it's genetic. They can't help it, but it's those cognitive feelings, that just those intrusive thoughts that come up. Now, the good thing is, again, I mentioned that it's treatable with therapy. Sometimes medication is needed, but the first step is to use coping skills. So, coping skills, I literally wrote the definition down: tools and techniques that we use to help us handle difficult emotions, such as being overwhelmed, angry, sad. It helps us decrease the stress and helps us maintain that kind of internal order of balance. And so, what do you think when you think of coping skills, Alex? Most people think of four
Breathing
square
techniques.
breathing,
Yeah.
taking a walk, getting a drink of water,
Talking to
listening to
somebody about it.
music, and those are great coping skills. Another good thing is when people plan these, they almost make these habitual, healthy changes in their life if they're dealing with anxiety. So they pay more attention to what they're eating. If they're sleeping right, they want to eat right, they want to exercise. If they're using substances, they want to stop doing that because that's not going to help. However, you can use avoiding as a healthy coping skill. So, for example, if I was really afraid or anxious to go on live, I could have taped this to you. So that could have been a plan B. Or if you just don't feel like going out with friends, you can say no because you just are not feeling it and you avoid it once, and that's okay. When it's a problem is when it's used to the more extreme, where you're avoiding something, you're not paying attention to the value of whatever it is anymore. So if you're avoiding work, you're not paying attention to the value of work, the value of a paycheck, the value of your job. In school, it's the same thing. You're not paying attention to the value of school and attending and getting those good grades. Um, so, um, avoiding a long term, really anything that's important or value to you, can be unhealthy. And you could always come to therapy, plug for patchwork, because there's a lot of amazing therapists here, um, a lot of great child psychologists, moving on up to adulthood. The goal here is you want to, if you are suffering from anxiety, you want to know that the goal is to manage it. Not that you want it to go away, even though you probably want that, but just know that we all deal with anxiety, and managing it is key. And it's kind of like a muscle. Like if you never worked out your arm muscle, for example, the first time you pick up a heavier weight, it's going to be heavy. And then the next time you do it, it's going to be a little less heavy and a little less painful afterwards, and so on. So, same with anxiety. Once you learn the tools to manage it, it usually does get better but you have to kind of like live in that anxiety. You have to, um, it's not fun, but you're kind of, you're just practicing true life, and you're learning that you can't always control your environment, but you can try to control yourself. Um, again, it's just the key is to manage it and learn some coping skills. The other thing, which I don't want to forget, is really, again, rely on the school. Some kids ask for accommodations like, can I sit near the corner of the room where the door is? Because if I do feel sick, I can leave right out. Maybe they'll make a signal with the teacher that if they do feel like they have to faint, they'll send a signal to the teacher, maybe just like this, and then they'll leave. The teacher, they already agreed upon that. They're sitting right near the door, and then they go. Another thing, and I could still remember this because I was really shy when I was growing up, and I could still remember, my name's Jennifer, a teacher going to call on me and saying the word Jet, and then I would tense up. And maybe they would say Genevieve. And I remember like, oh, good. And I just didn't want the teacher to see my work. And I remember them saying they're going to see it anyway, but that was like a little bit of a trigger to me. So we have some kids where they ask not to be called on. And teachers, again, 99% of the time, teachers and staff are great and they will accommodate them. You don't necessarily have to have a 504 plan or an IEP. There's something called response to intervention, RTI. I can explain all that at the end if you'd like me to, but those little accommodations, or maybe somebody wants to have lunch with their brother, and maybe that is a huge um, strategy that will help them. Well, more than likely, that guidance counselor could try to do it. Whether they can do it or not with sectioning and whatnot, we don't know, but that's another thing. Am I making sense so far?
Yeah, I actually had a few thoughts while you were
Okay.
talking, and I was thinking, you were talking about the signs of anxiety, and I was thinking, people that are in that, especially children, don't don't even know that that's what's happening, that that's what this is, and that having a good therapist like at Patchwork for your child, not only for your child, but now that you were talking about this, for the parent in having the right tools to assist their child, a good therapist for the parent to know, like, how can I help them through this,
Right.
and then also a therapist for the child, for them to know, like, oh, that's what this is, and it's not me, and there's not something wrong with me, and that there are tools, like you said, that it's okay if I talk to my teacher, it's okay if I have these special things in place to help me be more successful in school.
Right.
And I think I'm just thinking of my own experience in high school and my experience with a high schooler now myself, and my experience working in schools, and what a great tool that is to have the right verbiage and to have the right support system in place. And I know that therapists like you and oh, we have quite a few. I can't even name all of the great, Monica and Miss Julie, and therapists that actually work with not just the child, but actually have meetings with the parent then and say, like, we want to help them. We need to work together to make this an enjoyable experience that they can succeed in.
Right. You're exactly right. Because the bottom line is, you as a parent or guardian and the school staff have the same goal. The goal is to do well in school academically, with attendance, with discipline. So you're on the same page there. It's just like, how do I get there? Do I need to do baby steps? And I can give, if there's time, I can give so many scenarios, but really quickly, we had a student that was, and this was years ago. I didn't know her first semester, second semester. All of a sudden, she didn't want to go to school. And at the time, my office was mainly in the dean's office. So they asked me after she had missed maybe a week and a half to call. So I called the parent, and the parent didn't know what to do. And the parent's like, she had anxiety in maybe second grade, but now she's a freshman. I don't know where this came from. She was talking about not feeling well, so I have taken her to the doctor. We are getting tests done. I'm having another test in 2 weeks, and then we have to wait for the results. What do I do in the meantime? And this was a student who was doing homework, but she was still missing the instruction. So I made a plan. I said, please have her come to school tomorrow, but come to my office. So I had never met her before. We met in the morning. The mom was great about having her come. She was pretty shy. And I kind of just explained my role. And what we worked out is, maybe for the first 3 days, she just did the work in my a little outer office area. She just did her work there because at least she was in the school. So the goal was to have her to attend class. That was a long-term goal, but the short term was just getting her in the building. So we eventually moved from staying in my office all day to going to a few classes and lunch where she felt comfortable. Then eventually it was almost full classes. By that time, we found out, her mom called me, and it was a physical reason. The test revealed that it was maybe a thyroid issue or something. And once she was on medication, I mean, she was one of the easiest ones because there was a reason and it wasn't anxiety based and she was treated. And then I would only see her in the halls to say hi. I mean, that was it. Other ones, I've made home visits. I've met the student at the door because sometimes they don't want to get out of the car. Um, for some of those extreme cases, I'm jumping up ahead of here, but there's exposure therapy where I've offered to have the kids come. I would stay later and say they wanted to come at 5 o'clock, and we would walk around the halls where there was less students there. Or I would invite the parent and the student to come to a basketball game because that way it was a different setting, but they were getting used to being in the school. So, and then again, there's a whole host of strategies that we can use within working with the teachers, different accommodations and modifications um, that you don't need a plan for as far as an official 504 IEP.
I was just thinking how fortunate those kids are to have had someone like you in their school district and their school system, because not all schools um, have somebody in that position, and it is going to fall a lot on the parent being proactive and speaking to the teacher and speaking to the staff, um, which is another thing that that the parent might get anxiety about is
Yeah.
standing up for their kid, and those are a lot of the things that you can help with at Patrick is talking them through what options they have. And because of your experience in the school system, like, have we tried this? Have we tried that? And you can give them the right guidance as far as that is.
And that's part of the reason I took this job, because I was blessed to have amazing colleagues, amazing families to work with. And I have a lot of success stories, and some took a lot of hard work, some not as much. But they are available. And again, kids don't want to have anxiety. It's just something that comes up and they just want to be normal like everybody else. So why not? That's what we get paid for, in the schools. So let's do it. And some schools, you're right, they have a different plan. Some might be better, some worse. You brought up a good point about younger kids. With those kids, you might have to use different verbiage. So you might want to say, because like you mentioned, they might not know what they're feeling. So instead of talking just about like, okay, you're going to go to first grade, it's going to be in Mr. So and so's room 25, you also want to say, let's talk about how you feel, because maybe these are the kids that have a really gentle temperament as well. You might feel those butterflies in your stomach, or you might feel really worried, like you might cry. um, what do you do? So also talk about the feelings or separation anxiety. Talk about how they feel when you have to separate from them as a parent. And remember how you were sad when you had to be when I went out with my friends, but you were shy with the babysitter, but then it was okay and you didn't even realize I was gone. That's what'll happen here. And um, you talk about those kind of feelings. You don't want to deny their feelings ever unless you feel like they're being a little manipulative or trying to use the situation. Um, but you don't want to say, oh, you don't, again, this is more with high school, but oh, you don't know what pressure is. Just wait till you get in the work world, or you're fine. Don't even worry about it, because then they might feel like you don't understand them. So those aren't good strategies, but just try to relate. And I remember when you just want to validate how they're feeling. We call that in social work therapy terms. You just want to know and talk about some of your own experiences when you were young. Um, and sometimes less is more. And this is a parenting rule. One of our deans used to say this, and I loved it, and I use it all the time now. Less is more. Sometimes you don't want to get into a power struggle with your child. And, remember, you're the parent or you're the guardian. So less is more. If they're trying to fight with you about going and you're at the stages where it isn't that, it's not that severe, you just want to lay down the law. No, you're going. And unless you have a fever, there's a school nurse. You go through the nurse's office if you need to come home. Um, so those are some other tips. And school nurses also are very good about soon knowing the difference between a physical issue and a mental health issue. And I've had some where the nurse will say, why don't you, instead of going home right away, why don't you meet with the social worker and we'll do that first. So then we can talk about why you really want to go home. And in some cases, again, I know I'm not the only one. We've been able to keep the student there, or maybe keep them in my office. That's not a long-term solution. It's a short-term. Because again, we're just looking at the value. There are different options. There is alternative schooling. Homeschooling is an option. And again, different high schools might have different options. There's private schools. I will say, under the Illinois State Board, I personally don't know that much about homeschooling. But if you look on their website, there's a host of information there for parents that want to homeschool. When they have decided, because really homeschooling has been around for a long time, not just for school avoidance reasons, but if you have a teen that says, I am just not going to school, and it's just very severe. And there are hospital programs too that you can look into and Google. But again, if you want to homeschool, there you can look on the Illinois State Board of Education under homeschooling, and I just looked at it yesterday. There's a whole host of things to learn as a parent and your options.
Oh, sure. And it's not as scary as some parents think. I homeschooled my son for the first few years, and then when we moved to Colorado, we homeschooled, and then he went into regular school. And so I know the system in different states, and now we're in Wisconsin, and yeah, it's not as scary as you think, and it can be done if that's the direction that parents want to take. But
Right.
even when you decide to take that direction, I think I would definitely recommend therapy for both, because then it's just you and your child constantly.
Yeah.
And then some of those power struggles also occur
Right.
with if their avoidance issue was, like you said, gaming or some other thing, then that's still going to be an issue, even if you take out the other the school factor of it, and you're still going to run into learning to have rules and set expectations in those situations, for sure.
Yeah, that's another excellent point. You don't want to make, if you don't want to homeschool, you don't want to make the child's bedroom so appealing that they don't want to leave. But yeah, homeschool has been around for a while, and there's also, I don't know if this was the case with your son, but there's different rules and regulations about if they want to participate in a sport, or if they want to take one or two classes in the high school or middle school, and then homeschool for the rest. So there are options. You just have to, another parenting tip, say what you mean and mean what you say. So you don't want to say right away when it starts, well, if it doesn't work better, I have to go to work, you're just going to be homeschooled, because the child or teen might latch onto that, and you may not even really want that. But it really is a difficult, again, when things are really bad, I've seen parents very stressed because, again, they usually have to go to work, or sometimes they work from home, which you would think would make things easier, but does it really? Because they know they can be picked up because their parent is home, as opposed to working 40 minutes away. If there's just in big cases, it causes a lot of stress. But when you have the coordination between the therapist and the home and the school, and maybe a doctor, if again medication is needed and that's a family decision, and you need that assessment, it's more likely to work.
Yeah, I think all of that is perfect. I think Patchwork is so fortunate to have therapists like you that have this knowledge and experience, hands-on of
Yeah.
of the school system, and can actually talk through parents and be that support for the child too, to actually figure out what it is they're feeling and how to have the right tools to manage that. I think that's
Yeah.
great.
And, some schools are still starting this week. So some schools have been in for 3 weeks now, some are still. So I thought, this would be a good topic to address, and I appreciate your feedback.
Yeah, I almost feel like we should do this again in a couple months once kids have been in school.
Yeah.
Because yeah, we'll do it when they're starting school to know what to look for, and then we'll do it again when they've been in there for a while and we're dealing with it for real.
Yeah, that's fine. Or any other topics that come up, um, I'd be happy to address them. Like, when do you ask for a 504 plan? When, or an IEP, or what are, ins and outs of those? I'd be happy to. Unfortunately, we do have a shortage of school psychologists, school social workers, teachers, and that affects everybody. But the ones that are in there, just like the therapists here, just like you're part of us too, you're there because you want to be there, for the most part. And you want to help and you want to do it. So I know in Elmhurst and the surrounding areas, Villa Park, we do have amazing teachers, and amazing parents who homeschool or go through a different organization. So, because again, the shared value is to have our students learn and become what they dream to be.
Yeah, we really just want our kiddos to be happy and healthy and
Yeah.
successful in whatever they put their heart towards. So and for them to remember that we're all in this and we're all rooting for them, and that if they need support, they can get it, and we're here for them, and we'll get them the right tools and the right teachers and contacts. So that's really
Right.
wonderful.
And just a quick shout out to my daughter. I have 3 kids of my own, but my daughter works at Lewis University in the Office of Disability. So, real quickly about college age kids. Well, of course, they're prone to having anxiety, and they might have an IEP in school for, there's an assortment of disabilities, whether it's blindness, whether it's learning disability. And so most colleges have an office of accommodations, and you, as when you're looking with a parent or guardian about what school you want to go to, if this affects you, you want to check out their office of disabilities, because they can help you find success at that level too.
For sure. Yeah, and that's the kids are going through that right now. Just the separation anxiety part of being out and on their own in college, and needing to have a good therapist that they can talk to, and having those we had talked about this last week, but having those scheduled reliable times where you have somebody who you can discuss all of those thoughts and feelings with, and they can really point you in the right direction. Like, well, here's I'm not a therapist, but giving them
You're
the right
right.
tools and
Yeah.
and giving them the right like direction. Like, have you tried this? Have you, let's try that. I think it's huge for anyone that's um, they might not say struggling, but struggling. Yeah.
Yeah. Life is hard. Life is hard. It's a roller coaster, and there's so many good things going on in life. But it's up and down, and so many factors affect that. And whether we have a support system, what does that look like? Whether we have resources, where we live. You mentioned you live out of state. What are the resources in that state? I mean, I could go on and on and on. So, we're all in this together.
Yeah, and we all want our the next generation to be healthy and successful. So
Like,
for sure. I'm grateful for your time today and your experience and your expertise, and I'm grateful that you're part of the Patchwork team, and bringing all of that to this place and being able to help people. I think that's just wonderful. Thank you so
well,
much for
thank
for,
you.
for doing this today, and I will bring you back mid-school year.
Okay. Okay. And I'm sorry about the technical problems. I'll just go straight from my phone. So I
You
think
never know with tech, sometimes you never know.
yeah.
It's
Thanks,
technology.
Alex.
We roll with it.
Yes.
We're good.
Yes. It
So
was my
good.
pleasure.
Thank you everyone for joining today. We'll see you next week.
Okay. Bye bye.